Okay, chapter 24, complications of aging. Remember we said before, if you ever get a question and it has an age on it, it's probably important that you know the age of the patient to answer the question. So remember that. Senescence is a biological process or processes that lead to aging. They begin before birth. There are lots of different theories as to the cause of this, but it's also refers to the period from onset of old age to death. Excuse me. The aging process, the rate, and effects of aging vary among individuals. There are some 90-year-olds that look like they're 50, and there are some 40-year-olds that look like they're 80. So it may not match their chronological age. The rate of changes really depends on their genetics, their lifestyle, the status of their health, and cardiovascular fitness. Overall, women live longer than men. There is a general reduction in function that occurs throughout the body. The most vulnerable tissues are those that cannot regenerate effectively. The CNS, we know, nerves, skeletal and cardiac muscle, and kidneys. There are theories of aging. One is that it is a genetically programmed thing. You learned in Unit 1, I believe, about apoptosis, which is that programmed cell death. There's wear and tear. And it's just what it says it is. We've accumulated wear and tear on our body. We've accumulated waste. Things have changed slightly with the wear and tear. Altered proteins. Other things that are going on. Lots of different things. And then just random errors. There are latent viruses that can impact how we age. Autoimmune reactions can change, can increase. Environmental things. If you're in the sun a whole lot, you're going to be very wrinkled when you're old. Free radicals, peroxides, other things damage the body and can lead to cancer and other kinds of diseases too. Hormonal changes. Estrogen and testosterone change. The level of hormone secretion for the others remains relatively constant. The number of tissue receptors may decrease, and the speed of hormonal response may decrease. Reproductive system changes. In females, especially menopause, the average age of menopause is about 51, where the ovaries just don't respond to the FSH and LH anymore. There's no more ovulation. There's decline in estrogen and progesterone levels, and eventually the cessation of the menstrual cycle. Hot flashes can occur with these. We hear a lot of jokes about hot flashes. Mood swings with the hormonal changes, with social expectations changing. It's tough when you think about empty nest syndrome. Lots of things happen. You change. You change from being that young mom taking your kids every place to your kids leaving and going on their own, and you don't have the interaction with the other moms the way that you do. I'm speaking from experience. But there are different social expectations. There's different things that you're expected to do as you get older. There can be dyspareunia, painful sexual intercourse. And there's a lot of reasons for that. And some of those are listed for you here. In males, the testosterone levels will decline very gradually. Muscle mass is going to decrease. Testes are going to decrease in size. Sperm production may be reduced. We know that they're still capable of having children. The glandular secretions of the prostate decrease, and benign prostatic hypertrophy may occur. It's pretty common. Skin and mucosa. Some are related to genetics, and some are based on just exposure to sun, wind, weather, just being outside. Skin and mucous membranes become thin and more easily damaged. As a person gets older, the dermis gets much thinner, the sub-Q layer is much thinner, and the number of specialized structures decline, like sweat glands and receptors. I don't know, I think I've gotten more sweat glands. I sweat now more than ever. Changes in skin and mucosa, other things. The skin is dry because of reduced sebum. More wrinkles. Amen to that. Elastic fibers are reduced. Collagen fibers aren't as flexible. And we see those wrinkles around their eyes, around their mouth. Lesions happen. Skin tags, keratosis, lentogenes, other things. Hair gets gray because melanocytes are reduced in number. Mine has become very gray, except on the bottom. Mine is gray, and I pull up my ponytail, and it's still blonde. Very strange. And thinning of hair as the number of hair follicles decrease. Cardiovascular changes. The size and number of cardiac muscle fibers decrease. Fatty tissue and collagen fibers increase and accumulate. There's a reduced strength of contractions. The heart valves may become thick and not as flexible. Vascular changes then are going to cause a decrease in oxygen supply to the heart, and the cardiac reserve will be diminished. Arteriosclerosis. Arteriosclerosis is loss of elasticity, an accumulation of collagen, thickening of the arteriolar walls, increased peripheral resistance, tissue ischemia, and is the cause of some non-specific brain changes. Atherosclerosis. Things like hyperlipidemia may be a factor. It promotes the accumulation of cholesterol in the walls of the large arteries. There's increased peripheral resistance, tissue ischemia, peripheral vascular disease, strokes. Commonly, this is what causes angina and MIs. Osteoporosis. These are vertebrae. You can see on the right is a vertebrae with osteoporosis. It's got many more holes in it, and it's flat. It's compacted versus a normal vertebrae on the left. Wow, my back hurts. Osteoporosis is loss of calcium and bone mass. There's a higher incidence of postmenopausal women. Things like fractures of the spine. You saw what happens in that picture. Risk factors: Asian or Northern European ancestry, low body mass index, decreased estrogen levels as we get older, a sedentary lifestyle. If there is a decrease of calcium, vitamin C, and D, then osteoporosis is more prominent. I don't drink milk, but I will eat cheese, and I take vitamin D. So, decreased intestinal calcium absorption is a factor too. How do we reduce the risk? Calcium and vitamin D intake, weight-bearing exercises, bone density tests for women at age 50 years or earlier if there are indications. I've had several of these, and so far I'm good. Osteoarthritis. Osteoarthritis is a degeneration of the cartilage in the joint. It can be associated with trauma or sports injuries. Often what happens is that articular cartilage in the joint thins out very thin. Usually this is in the larger weight-bearing joints, the hips, the knees. You get pain and stiffness, and this is where joints are replaced. A herniated intervertebral disc. Fibrocartilage in the intervertebral disc degenerates as we age, and people do get somewhat shorter. Sudden stress on the back could cause a herniation. Anything that causes pressure on the spinal nerves, and the pain is severe. Other things that can change in the musculoskeletal system. The mass declines with age. We said that before already, somewhere else. Depends on the level of fitness. There can be muscle contractions that will decrease in strength. You may not be able to lift, hold, move, open a jar. I can't open jars as well as I used to, I can tell you. Your flexibility is reduced and the stiffness becomes more evident. Coordination and balance can be reduced too. We need to look at all of these things in our patients. What about respiratory changes? Everything doesn't move as well, isn't as flexible, even the muscles around your lungs. So ventilation is limited. The lung tissue itself loses elasticity. The costal cartilage calcifies, and the ribs don't move as easily to breathe in and out. The intercostal muscles weaken. Everything is less. Expiration is reduced. Residual volume is increased. There is a decreased expansion for deep breathing and coughing. Harder to take a deep breath. Hurts to cough. Can't get in enough air to cough it out anymore. And then there are vascular changes that are noted here. Reduced gas exchange in the alveoli is probably big, and decreased perfusion. Neurological changes. There's a natural reduction in neurons with aging. Lipid accumulates in the neurons. There's loss of myelin. Remember we talked about those myelin sheaths and how fast something travels in pain if it's myelinated and how it slows down if it's not myelinated. So, decreased response to neurotransmitters and a slower response time. Changes in vision. The lens in the eye actually becomes less flexible, so it doesn't accommodate. It can turn yellow and be less transparent, and you're seeing cataracts. Look at if you have a pet, look at your older dog. Every dog I have had developed cataracts at one time, and you can see those very clearly in their eyes. Maybe I should take a picture and use it here. Night vision is reduced. Distance vision. Color vision may be reduced. And the vascular degeneration may affect the retina. Other changes in sensation include hearing loss. There are changes going on in the inner ear. Remember, there are even bones there that can be impacted. Sense of taste may be less. Sense of smell may be less, and may actually be a safety issue. If you can't smell a chemical, a toxin, a fire, you can't discriminate among odors. Now, the other thing that does, if you can't taste and you can't smell, then food tastes different. Food won't taste the same. Somebody's favorite food won't taste the same as it used to, and they may not want it anymore. So one of the reasons that older people may have a decreased appetite and a decreased nutritional status is just this. Maintenance of good nutrition then is going to be a problem. Anorexia may happen. My grandmother didn't want to drink because she would have to get up and go to the bathroom. She couldn't always get help to do that. And so she just wouldn't drink anything, hardly anything. I don't know how her kidneys functioned, but she rarely would drink anything. An older individual may lack money for adequate nutrition. While my grandmother had money, she didn't want to spend it. And they would deliver meals to the elderly 5 days a week. And my grandmother would get that lunch meal and split it. She would save the milk for morning to go with some cereal. She would eat the vegetables. And then at night, she would eat the meat with a piece of bread. And so that's what she did. Muscle weakness and fatigue can also come into play here. Obesity in older individuals increases the cardiac workload. You have to worry about hypertension and atherosclerosis, as well as type 2 diabetes. GI changes in nutrition, the atrophy of the mucosa and the glands, We know reduces digestive secretions, impairs absorption of some vitamins, including B12, calcium, and iron. So it's a good idea to check for iron stores, for iron levels in the elderly. Constipation is very common in older adults. It leads to hemorrhoids, which hurt, which leads to more constipation. Urinary system changes. Kidney function is reduced. Nephrons are lost. The system fails to adapt to changes in electrolytes and acid levels. And so there is a reduced capacity of the kidney. There's a reduced capacity to excrete things like the drugs that we're giving. So they may build toxic levels very quickly. They might not clear like they should. So it's very important to check these levels. They're going to be different for an older person. They're going to be different for a very young person too. Weakened urinary sphincter and bladder, so that nocturia may be an issue. They will get up and go to the bathroom a lot at night. And then involuntary voiding of urine sometimes. Other factors are things like infections. We've talked a lot about delayed healing sometimes, and this is no exception. As you get older, you have a reduced rate of mitosis, and so it does slow down the healing process. The immune response is not as quick to jump in and do what it needs to do. Cancer is an issue because over time you have exposures to carcinogens, and over time that accumulates and builds up to the point that you may be more likely to have some cancers. And then autoimmune disorders are more likely to start to appear. What did I just do? Okay, multiple disorders are common in the older population. The integrated treatment for all interacting problems is necessary. You can't just treat one problem. They can't go to one doctor for one problem and one doctor for another problem and one doctor for another problem. There has to be some sort of collaboration and coordination. And oftentimes that falls to the nurse to be the one to make sure that the treatment they're getting from everybody is synergistic. You want that integrated treatment for everybody, for all problems. Changing one system affects all the others, so everybody has to be on board. There are synergistic effects, that more complications because of more disorders. Large numbers of medications are common in older people. I went to a conference one time and they said nobody can take more than 3 drugs for more than 3 days and do so consistently and accurately. Think about all the medications that your older people come in with. It's amazing. They take prescription medications. They take herbal medications. They take home remedies. They take over-the-counter medications. They take so many things. There is an increased risk of undesirable drug interactions as a result. Older people, younger people, and in-between people don't understand that some of these herbs and minerals can interact with the prescribed drugs that they may be taking. Feverfew is an example of something that I can recall right off. Compliance can be a problem. Like I said, 3 days, 3 drugs, you can't do it. It's often necessary to adjust the dosage and the combinations so that there's not overdose, so that there's not excessive toxic buildup. We know that there's unpredictable absorption, distribution, and elimination. Now, this may be the last slide.